Good evening, everyone. And once again, thank you very much for joining us for our 6th episode of Academic Dialogue in Hargeisa, Africa 1440 webinar series hosted by the Hargeisa Cultural Center. Today, we're going to have our 6th episode, which will be focusing on regional cooperation in COVID-19 crisis. And tonight, as always, we have an excellent panelists organized or set here. The first speaker, the 4 panelists tonight and the main speakers for the night are going to be first Dr. Saad Ali Shire, who is the current Minister for Financial Development of Somaliland. Dr. Saad Ali Shire has served in several ministerial key posts that include the Ministry of Foreign Affairs and International Cooperation. And he also has served as a minister for the Ministry of Planning and National Development. Dr. Saad has a PhD in economics from Pennsylvania State University, and it's really a pleasure to have you with us, Minister, for this series. And the second main speaker is going to be Dr. Abraham Meder, who was part of this webinar in the first episode. I hope most of you remember that. He is a medical doctor practicing in the US starting 2000. He is specializing in internal medicine. Currently, he's also part of the caregivers for COVID-19 patients in Minnesota. Dr. Meder also teaches at the Medical School, University of Minnesota, and he has a MS degree in economics, policy and management from London School of Economics. It's also important to mention Dr. Abraham Meder is one of the people who are working hard to bring support to Somaliland communities through fundraising, health equipment delivery, and awareness creation. So it's a pleasure to have these two as the main speakers for our 6th episode. The respondents for the night are going to be Lidat and Dr. Najah. Lidat Tadessa is a Pan-Africanist who is Pan-African peace and security professional, interested in the global peace and security affairs. She has worked on peace and security policy as well as peace building practices, mostly in the Horn of Africa. Her area of interest and professional background includes African continental and sub-regional cooperations, which we are very interested to cover today, and also peace and security dynamics. She always mostly focuses on the Horn of Africa, and also she is interested in the EU-Africa relations in the domain of peace and security. She is currently working at the European Center for Development Policy Management Institute. So Leda, thank you very much for joining us again. And the second responder for the night is going to be Dr. Najah Mohamed Adam, who is a development practitioner and researcher with more than 10 years of experience in managing development projects. Currently, he is a deputy fund manager for the Somaliland Development Fund. Before that, he was engaged and worked as head of the Office for DAIS, which is Transition Initiative for Stabilization in Somaliland. He's a recent PhD graduate specializing in foreign policy analysis, and he has contributed a lot in the academia, and most notably his article, Regional Cooperation, Economic and Integration, presented in the Somali Study Congress is worth mentioning. So these are the 4 panelists we are going to have for the night through the moderation of Hibak Abdullahi Said, who is a social and youth activist who studied in Sudan and Newcastle. She has a lot of contributions to the youth awareness creation, but she's one of the organizers and speakers in the first TEDx in Hargeisa. She's also a co-founder of the Inspire Group, which most of us remember from the presidential debate for 2017 election in Somaliland. So she will be the moderator for the night. So thank you very much, everyone, for joining us. Those of you who are following us on social media, especially on Facebook, and everyone who's joining us through the webinar as an attendee, I would want to say welcome and pass it to Hibak to do her moderation. Thank you very much. Hibak, you can take it from me.
And thank you, Turset. Thank you and HCC team for having us. Well, as Turset introduced this, we are covering the necessary to have regional cooperation in times of on one where we all are challenged to lead us through the presentations that panelists will answer. And the following question will be, and first question will be, what has been the main challenge in the area of regional cooperation to address pandemic like COVID-19? Second question will be what are the structure put in place and how is their function? And third question will be what is the current challenge in the health and the continue as a whole and the region in particular. And question number 4 will be what shall be the way forward? And I will leave you to Dr. Jama to say a few things before we start with our first speaker and Dr. Saad Shire.
Thank you so much, Hibaq, and thank you, Tirsit and team and organizing team to having us one more time in this sixth episode of Africa 40 and 40 webinars. It's a really, really great pleasure to have His Excellency Dr. Saad Ali Shire, the Minister of Finance or Financial Development. I know he has a tough week and really tight schedule that we were coming back together from Sheikh for the University of Sheikh and other missions that he had in that region. So I'm really thankful the Minister to have joined us. Just few words. If we learn anything about this crisis, this pandemic, is that every country should survive what really owns at that moment when the crisis came. There is no time to expect anything comes from outside, any support, aid, or otherwise coming from outside in order to face the challenge. This is something that we did learn in the few first days of the coronavirus pandemic, and it is something that can come back. So every country should be ready, first of all, to start what they have in at that moment when the crisis came, because there is no sort of information coming before the pandemic. So it's something that coming out of the blue, so we should be prepared. So that's something that a real lesson learned is to certain countries, in particular in Somaliland and in our region, to give a priority about the food security, which is the basics of life. So that's having said that, when this kind of crisis comes, it becomes compulsory to live beyond the frontiers, if you want, and see how we can survive with the regional cooperation. And for that reason, we call it 2 experts, 4 actually experts who are working in this area in different capacity, and how the regional cooperation can come the source of, if you want, the sort of survival when a country can't make it, because of it's really difficult that every country can do by itself. So that's what we are expecting, and hopefully with the attendees that I see, the number is becoming more and more, and our panelists is to cover. The last thing that I would say is for just technical to invite all our attendees and people who are following us on social media to leave your questions. Please don't wait last minute with your list of questions, as usually happen. So as soon as our speakers start speaking, please put your comments so the team, the organizing team, can pass to the question. With that, I hand over again to you, Hibaq, and thank you so much for coordinating and moderating this event. Thank you all.
Thank you, Doctor. And I will go with our first speaker, Dr. Saad Ali Shire. Will come on board and speak.
Well, thank you. Good morning, good afternoon, good evening, everybody. Assalamu alaikum wa rahmatullahi wa barakatuh. But I was asked to talk about regional integration outside the health subject. That was left for Dr. Abdulrahman to cover. So I'll talk about the integration from an economist's perspective. And to put that into context, I will start with globalization first. Now, in the past, that's centuries ago, people lived in relative isolation. Each area was self-sufficient or quasi-self-sufficient with little interaction with the rest of the world. The fact that we have today more than 6,500 languages spoken in the world is a testimony of that isolation. But with the development of steamboats, locomotives, automobiles, waterways, and networks of roads and rails, countries and regions became ever closer and interconnected. And with the advent of air travel, things changed rapidly. In 2018, 4.6 billion passengers took to the air. The introduction of supermax cargo ships and triple-E container ships has made intercontinental trade cheaper and faster, connecting suppliers and consumers around the world. The phenomenal growth of air cargo from humble beginnings years ago to over 65,000 million tons in 2019 shrank delivery time considerably. The global financial institutions made possible instant transactions around the world. And the mobile and the internet paved the way for creating a small virtual globe where 5 billion mobile users, 4.4 billion internet users, and 3.5 billion social media users continuously communicate, rendering physical space irrelevant. The globe has even adopted a franca lingua, that's English, and a franca currency, that's the dollar. Now, everybody thought that the globalization was here to stay, is inevitable and irreversible. That was before the coronavirus pandemic came along. Coronavirus pandemic revealed the weaknesses of globalization and global interdependence. Now, to check the spread of the disease, entire cities and countries in every continent were locked down, borders were closed, foreign nationals were evacuated, airlines were grounded, ports were shut down, exports of certain medical supplies were banned. The globe became disconnected physically once more, though electronic connection remained strong. Countries whose economies depended on international tourism, international trade, and international finance at the forefront of globalization were hit hardest. And globalization became less dependable and less reliable. Now, in the post-coronavirus pandemic world, we face three choices: to fix the exposed weaknesses of globalization by anticipating and preparing better for shocks like the corona pandemic, withdraw from the globalization and seek self-sufficiency in isolation, or to find a middle ground where we remain connected but less dependent on faraway places, which means strengthening regional integration and cooperation. I would personally advocate for the third option, where the region of the neighboring countries become more integrated in terms of economic activities like trade, travel, infrastructure, investment, and financial institutions, in terms of social service professions like health and education, and in terms of academia like universities and research and development centers, as well as security and legislative and judicial establishments. This may create a less open and less efficient system economically, at least, but it will certainly create a framework more reliable and less exposed to international shocks like the pandemic and financial crisis. Now, in East Africa, we already have regional organizations like COMESA, Common Market for Eastern and Southern States, ECA, or ECA, East African Community, and IGAD, the Intergovernmental Authority on Development. It's a matter of broadening the scope of these development organizations to embrace regional integration. Perhaps we can start the integration journey with a conference on post-pandemic East Africa before the end of the year to strategize the way forward. Thank you. Over to you.
Thank you very much, Doctor. We're glad that you share with us all this information, which is going to be very important for the audience as well. Please feel free to share with us your questions. We will be forwarded to the speakers. I will go with our second speaker, Dr. Abdurrahman Madar. And Dr. welcome.
Thank you, Hibab, and thank you, Hargeisa Cultural Center. I also thank to my co-panelists, including Dr. Saad Al-Shira, who I admire his work most. Well, as we all know, COVID has been in the news for the last 6 months or so. And let me give you an overview of where we are in terms of patients, casualties of COVID. Worldwide, close to 12 million cases are confirmed, and a little over 500,000 deaths attributed to COVID. That's worldwide. If you look in our continent, Africa so far had close to 500,000, 494,000 confirmed cases and 11,000 deaths. Let me then compare that to United States, just for population-wise. In the US, there is little over 300 million. That is Ethiopia and Nigeria combined in terms of population-wise. So in the US, there are 3 million confirmed cases and over 130,000 deaths. And what I also like to emphasize is confirmed cases, when I am referencing to 494,000 cases confirmed in Africa, it doesn't mean that is all what Africa has. It is the ratio. It is how many tested and how many of these tested patients are positive. So always keep in mind that the numbers that we see on the screen are not real numbers. They are a proportion of those who tested. I don't think we tested 1.3 billion Africans, and then we had 494,000. Having said that, I will come to our regional cooperation, which is the first question. I think health is really unique. Health, we usually call in health economics, health is not a usual commodity. Usual commodity is that demand and supply controls the price. Health is really different. So because there are a few unique things we call healthcare is not transferable. Other wealth you can transfer, so it is owned to you. You cannot expect the outcome, even when someone, your doctor or your nurse gives you medication, if they can guarantee. I think the healthcare is really unique, and it needs to be looked at different than other services that we use in economics. The problem is that we have, in my view, in the continent is, of course, cooperation is extremely important in every aspect of life. What we learned from Europe is that they really collaborated well, although they had mishaps at the beginning. So you would see in the news that Italian patients being transported to Germany, some ventilators or equipments that being moved from country to country. So cooperation will learn. But what we more importantly learn from a COVID invasion, I call, is the COVID-19 tested every and each country's their own health system strength. That has been tested. And in our continent, the healthcare infrastructure was weak to begin with. And that is not new. If you recall, in 2001, there was an Abuja declaration that all member states of Africa took part. What they agreed was to increase the percentage of GDP that each country allocates for healthcare. And they agreed that should be no less than 15%. Today, if you look, you will see very few, I think one or two reach that level. Average African countries invest their healthcare infrastructure like 5 to 6%. Give you an example of the other extreme. I'll use the Nordic countries, like a little wealthy, small North European countries, Norway, Sweden, Holland, Denmark. They usually spend roughly 9%, 8% of their GDP into healthcare system. UK and Canada, around 12%. So in my view, the most important thing is investing healthcare system in each country. I know, and we all know, there are priorities that will come. But I think if you look some countries where the military side is getting a state-of-the-art military equipment, but the healthcare infrastructure hasn't changed, that will tell you it doesn't mean it is poverty, it means it's a policy choice. So that's a big it's a bigger picture. Statistically, in Africa, from recent report from Reuters, I assume, May, we have one ICU bed, less than one ICU bed for every 100,000 patients. And that example in Germany, they have around 38 ICU beds per 100,000. So there is a basic discrepancy that I don't have to bother you, you all know. In terms of COVID-19, we learned that it had exposed these already existing infrastructure problems. As Dr. Ali Shire adequately described it, there is a huge interconnection in the world, which is accelerating the spread of COVID-19, which is unfortunately also spreading the misinformation of COVID-19. The impact that COVID has is huge, and cooperation among our countries, either regional bloc or a bigger bloc, would be immensely important. I fully agree that with Dr. Shire and everyone else who shares the idea. Where we are now, we have African CDC, or African Centers for Disease Control and Prevention, established in 2017. It really did well reacting to this COVID-19 pandemic. We're knowing that the testing is the most important strategy to utilize in terms of fighting this COVID-19. From February to April, Africa CDC spearheaded a campaign that made the number of countries that are able to test COVID-19 from 2 countries to 42 countries in 4 months. That is really a success. What I still have a real little question is the Africa CDC plan. They did that, they also did training, but most of their funds comes from, if you look their website, it's funded by EU, like 20 million, I was reading their website last night, 20 billion euros has been donated to Africa CDC, individual countries like Nigeria, Ethiopia, Horn Africa. So it is a donation. So how I see now is a more kind of you can call a substation of already existed giant donors that used to donate Africa. So it is extremely important when we are fighting this huge pandemic with required resource mobilization. It's also important to sustain this, the fight against COVID-19. The initial resource mobilization spearheaded by member states and Africa CDC, we expanded testing, we expanded mitigation processes, awareness campaign, social distancing. But what's also important, when you have, that many tests being done, the machine and testing needs continuous quality improvement. We have some areas that the testing is being in question. The training needs to sustain. So all these things would need beyond these initial mobilization of resources that either collected from member states or receiving donations. The most important thing that I would like to contribute to this panel is we need to advocate for a regional bloc, but much more importantly, individual member state is strengthening of their own healthcare system. And that is important. As economists, you can make the case that every penny spent in healthcare would turn out to be an economic gain for the overall community. Another important thing that I like to emphasize is that the huge media and fear and fight against COVID-19 also impair the already existing programs, including in Africa, HIV and TB control, immunization is for children. The global supply chain disruption that Dr. Saad Ali Shira mentioned had a huge impact on maintaining and sustaining these already existed channels that we used to use for maintaining these programs. What I also like to move on to, what's next for Africa? What's next for Africa, I think it is important. I agree to strengthen the regional bloc, but I think individual and local policy, sound health policy is more important than starting with a bloc. Like an African CDC office is a more political organization rather than a pragmatic and practical organization. What I mean by that is, it is covers an umbrella where we have over 54 small, let's say 54 other countries with a different policy, different priority, and different leadership. I would emphasize that encouraging regional cooperation by using the already existing channels, including the Africa CDC, but also getting back to local and own individual countries. I'll use an example that I was reading the news yesterday. The military base in Djibouti, that military base, they donated to the government of Djibouti hospital beds. So they value the valuation of these, they estimate around $9,000. So imagine when $9,000 worth of supply is being donated to the country, and in the media, it still says donation. I want us to look the Western countries helping us. I also want us to take ownership of our own. I will use an example for foreign aid. I will leave Dr. Ali Shira, who is much more knowledgeable than me in that area, but I know that Somalia, the southern Somalia, non-Somaliland, in 2019 alone, there has been 1.9 billion foreign investment. And we know where we are, where Somalia is right now. So I like to see Africa CDC office not publicizing their website all about Europe donation and Gates Foundation donation, and emphasizing small, measured activities that they can afford from their local own member states. That's more sustainable, and that is more socio-economically feasible. I would conclude that moving forward, I would like to emphasize that it is important to create health policy that is local. I will use two examples that we use. In Africa, there are great examples of exceptionally excellent healthcare systems, relatively speaking. Botswana and Rwanda has a great healthcare infrastructure. And if you listen how the foreign media and Western media describes Africa, it is really different. They will tell you Angela Merkel, she had a few consecutive terms, but she's not a dictator. But she has a great Germany. But Paul Kagame has a few consecutive terms with exceptionally good reputation, and he did well in healthcare system. That's as far as I can tell. And he might sound a dictator. So I am in support. It looks like I'm going out of my little COVID-19 talk, but it is important when you have a healthcare system, it starts with your own healthcare system member state. I will conclude that we need healthcare policy makers who are, I call, learning leaders rather than a legacy leaders. So you don't have to stick with the old way of doing things, that you wait for donation, but you do what you can. Great example. Tirsti mentioned that I was working with a Somaliland COVID fight. I know that the first WHO provided a machine that would test the PCR machine test, and the market value of that machine was less than 50,000. And it has been waiting for a really long time, that machine. When it came in, it still needed a problem. And I also listened to another Dr. Ahmed Hussein Xiiso from Somaliland, who is part of the COVID committee. He was telling that they are planning to have every bed in Somaliland would have an oxygen delivery, and that was kind of local made. So I would conclude that COVID is still there. It has no vaccination yet, and it has no treatment yet. Additionally, it is not clear that Africa has less numbers in terms of numbers we publish, but definitely there's more COVID-19. Good example, very own Somaliland, small Somaliland country, they reported around 3,000 confirmed cases, 3,000 tests, and around 700 positive. So out of over 3,000 people tested, 700 were positive. The positivity rate is roughly 20%. So positivity rate of 20% is a big deal. We know the cases may be mild. Our patient population is younger. How we live is not like these large nursing home or elderly population is that the Western people have. There are a lot of differences, but the existence of COVID-19 is still there in Africa, but the reporting is less. I will leave that with my brief talk and will be happy to answer any questions. And back to you, Hibaq.
Thank you, Dr. Abdurrahman. I hope all these information that you share with us and the advice you share with us is very important to each and everyone who's listening and watching this live. And I will go through and continue with the response. I will start with Dr. Najah, respond of Dr. Saad.
Thank you so much. I will start with I will basically categorize my talk in three little categories. I will first start with reflecting on the speech made by our Minister of Finance Development, Saad. Spot on some challenge that I see coming as a result of the COVID-19 pandemic, and then conclude with the opportunities that I see may lead us to have a better way forward in managing the COVID-19 pandemic outbreak and its aftermath as well. So the first reaction I will make to the statement of Saad is that which he eloquently and adequately provided a sufficient context into the discussion that we are having tonight. It is true that the states are the primary or the sole actors of the international system, able to deliver public goods and service delivery within their own territory. You may also see from the recent political development in the world, like nationalism, unilateralism, and protectionism, which has gained immense amount of popularity in the recent years. A good example of that is Trump election, his immediate withdrawal from the JCPO, WHO funding and support, the Brexit in the UK, a niche or narrow niche of Marine Le Pen, leftist in French. So all those events seem to be confirming or actually promoting vertical concentration of power in creating more state and less interaction among the states. However, we also see that wide range of problems came into the international system in which one state can unilaterally handle, or put it differently, can be handled more efficiently and more effectively in through collaboration. Good example of those challenges that emerged in our world includes the COVID-19 pandemic, which immediately cut across the board. WHO officially announced COVID-19 as global pandemic March this year, and in a matter of 10 days, Somaliland confirmed this first case. So it does shows you the strong parallel between the unilateral worldview and another competing worldview of multilateralism, cooperation, and regional integration among the state and communities. So what I'm trying to say is we therefore need to act together. There is no state that can leave its own means in handling those problems. One good example is we know today 40% of the world trade is conducted through regional plugs, and that is more than $12 billion worth trade goes between those. And in the case of Africa, we have 8 regional economic operations, the GDP of more than $2.6 trillion, with an equivalent population of 2.2 billion. And you see how that creates an opportunity, an interaction among the different states. We also understand that Somaliland situates in Horn of Africa, and the regional plaque that we fall geographically in is among the least performing in terms of interacting, cooperating, and collaborating with matters that that cuts across the borders. So there are quite a range of challenges that are now facing the world, but from international system perspective, coronavirus seem to be turning the tables both to the unilateral worldview as well as the multilateral worldview, as Dr. Saad brilliantly put it. Among the key challenges that we have within the African context and our region in Horn of Africa includes that the coronavirus has increased the 135 million persons that were in starvation, and that seems to be increasing. The pandemic continues to the second half of the year, which is going to be the case anyways. Africa economy is going to contract close to 4%, and the assumption goes along with the fact that the coronavirus is going to live with our society beyond June this year, which is in the case. So it is crippling the economy. Somaliland is not different from those countries who are suffering from those challenges. We are not recognized, but we are trading with the world like any other country. Food, energy, utilities are definitely imported from the outside world. Border closure immediately impacted our economy. It did also shifted the policy makers' focus from other social spheres merely on public health issues, which is probably the right way of doing it, given the magnitude in terms of challenge. I would also add on key opportunities that we may look forward.
One more minute.
I'll try to be as quick as possible. Coronavirus seems to be become a wake-up call to African states that we cannot live alone by ourselves. Think about our food security. We also need to think about creating a safe trade and travel corridors. Further trade integration is another opportunity in which policymakers can work on. Policymakers should also need to think about a beyond COVID economic and thinking, deep understanding of the nature and the structure of the economy and cooperation in the region is also pertinent opportunity that we can work into. Negotiating a kind of free trade agreement, the amount the states who are living in the neighborhood is also another key aspect that we can work on. And one final opportunity that I see is possibility of establishing a joint investment fund among the neighboring countries in a quest that they can facilitate a movement of monies and investments between the regions in a way that it can revive the economy once the outbreak pandemic ceases. So I should confine my self to that limit. I thank you so much. Well,
Thank you very much, Dr. Najah. And sorry, and we are running out of time. So, and I will go through with then our new friend and lead it and welcome him for one day and respond Dr. Abdurrahman Madar.
Thank you, Hibak, and also thank you, Hargeisa Control Center, for having me. It's a pleasure to be here. I'll first perhaps summarize a couple of things that Dr. Abdirahman said that stayed with me, and then try to weave in some of my thinking on this conversation as well. And some of these points also, of course, respond to what Dr. Saad Shirey was saying. One is this issue of globalization. I think with globalization, we've sort of seen both the dilemmas of globalization, that on the one hand, we can't live with each other. On the other hand, we can't stand each other because, as someone from the audience noted, the moment COVID hit, it seems like everyone was closing borders, and then there was some sensitivity as to how much cooperation countries wanted to do. So there's some interesting observation there. And in addition to that, the other one is also how through globalization and our adoption of relying on other countries, other entities, how, as Dr. Abdirahman mentioned, COVID has sort of exposed the limitations of national health systems. Of course, this is not a reality only in the African context, but also in the American one as well. I think there's a big conversation in the US as well on where the health systems and where the gaps are. So there's that. And I think it has indeed brought in this understanding that health cannot be something that would be left on for the cooperation or the charity of others, but that it is primarily the responsibility of the government or the responsibility of a nation to develop its own health system and to develop it well. So I think that point is well taken, that there needs to be an investment. In the context of Africa, I think this has also sort of triggered a public discussion on why so many countries and so many governments had abandoned their health systems as well. Because in some context, in the national discourse in Kenya, for example, in Ethiopia, you have seen people taking out, mostly on social media, castigating the leaders for abandoning the health systems and for letting them know that all of the money that was skimmed off or all of the neglect that has been paid to the health system now has rendered all of us vulnerable, which in the longer term for the democratic exercise and government accountability is good, that you see citizens responding and wanting to hold governments accountable. The other thing is, as Dr. Abdirahman mentioned, in the case of Africa, of course, COVID is just a new phenomena, but it's not the only phenomena that requires urgent attention. As he rightly mentioned, so many countries are already dealing with so many other health issues that are as pertinent and as urgent, because some of these issues are also communicable. Like if you talk about tuberculosis, that's a real challenge in so many countries, but also other diseases like malaria and HIV are those that definitely require intense government response. And now there's a risk that because this is a pandemic and one that gets transmitted from one person to another very quickly, requires consolidated effort, but then all countries would have to balance their resources as well in order to respond to these multiple risks. So how do you balance this? How do you respond to COVID on the one hand, but also on other health concerns is another issue that many countries are dealing with. But the one thing that I would like to add on is, as Dr. Saad mentioned, and then also Dr. Najah mentioned, that for the continent, COVID is not just a health crisis, it's actually an economic crisis. And that economic crisis has actually hit the continent, I think, way faster than the health crisis has. So for a lot of countries, keeping social distancing, closing borders means you're losing millions of dollars on a daily basis. And at the individual level, it also means that so many of our citizens are losing their livelihoods. Others that also depend on remittances are also losing remittances because their relatives cannot send money in time. So when we talk about COVID, I think it's very important to understand that for the continent, and perhaps more so than other continents, this is particularly an economic question as well, and how it manifests. But that said, I mean, just not to end with gloom and doom, I think there's also a certain level of conversations around the need for self-reliance that is coming up in the African continent, that understanding we can't really rely on everyone all the time. We should also have our own plans of how to go about it. And there you have perhaps more interest in revitalizing conversations around the African free continental trade area. And then the other one is also how we have seen innovation and ingenuity across the continent. Countries like Kenya, for example, have managed to use some of their testing machines that they were using for HIV or tuberculosis and then quickly turn them into capacity for testing COVID. We've also seen that in the case of Senegal, for example, a laboratory in Senegal was able to produce a testing kit that would, when finalized, cost less than $1. So despite the circumstances and difficulties, COVID has also, the need, I think, that it induced has also opened up an opportunity for Africans to innovate and for Africans to think about a way forward and express their agency, which I think is a very important point also when thinking about the way forward.
Thank you very much, Lidit. You was really on time. So now, inshallah, we will go through the Q&A session. We'll take the questions and one by one from our audience. Yahya Yusuf asking Dr. Saad, Dr. or Najah and Dr. Madar, he was asking to, he was saying, do you think that coronavirus taught us are valuable in not trusting each other after the pandemic? Dr. Saad, Dr. Najah, and Dr. Abdurrahman. The question is for three of you. Let me say it again. Do you think that coronavirus taught us are valuable in not trusting each other after the pandemic?
I didn't get what you said entirely. You said, do you, can you say it again, please?
Yes, yes, of course. He said, and this is Yahya Yusuf and our audience. He asked to, and so do you, he said, do you think that coronavirus taught us are valuable in not trusting each other after the pandemic?
Right. I think in terms of the of mistrust within a global context, I think that's true, definitely. Because I think we anticipated support from the international community at a higher level than we have perceived. It seems like instead of assisting those of us who are less, with less means to deal with the issue, with the coronavirus, the disease, the world has closed its doors to us. Instead of opening the doors, they closed the doors to us. So I think that has created a sense of disillusionment in a way and mistrust. But also internally, as the doctor said, there is no cure for the disease. There's no vaccination for the disease. We can only try to prevent the disease. And in order to prevent it, we must maintain social distance. And that social distance, of course, have created, we're a very, socializing community. And that fact that we have to keep a distance in space, I think created also some sort of, mistrust. But also the mask and the gloves also create, mistrust and panic in a way. A friend of mine today went to the market and she was shouting at because she had a mask, because people thought that she was carrying the coronavirus. So I think, indeed, there has been some sort of... I said, I have a friend who went to shop at the marketplace today. She has a mask, and the traders shouted at her because they thought she was carrying the virus. There's a lot of mistrust associated with the mask and the gloves, which we need in order to protect ourselves and protect others, whom we might infect. So there's an issue of mistrust globally between countries, but also an issue of mistrust within the community, because of the way we have to behave and deal with the coronavirus. Over to you. I hope I have answered the question.
Yeah, you did, Dr. With the inshallah, Dr. Abdurrahman, do you have anything to add with this and answer?
I think Dr. Saad Ali eloquently put it, so I don't have that much to add. What I would say that the mistrust, I would say it in two levels. Mistrust in between two people, two persons, that should be there in the long run. So the mitigation is, I said that even before, the mitigation is that we are fighting with coronavirus, including social distancing, washing your hands, cover your cough. They are actually preventing from whole other diseases, including the TB and infectious diseases that are common in our continent. So social distancing and hygiene And all these things I advocate to sustain beyond COVID as much as we can. In terms of global mistrust, I would say that the mistrust needs to be defined. I don't personally believe that there is trust at all. There is a interchanging interests. That's what the countries and communities do. And there is no free lunch. So I want to make sure that our younger audiences don't get what I call illusion of inclusiveness. There is a kind of interest that we are sharing each other. So, and that is definitely impacted by COVID, and it will create, of course, a new way of collaborating. So I would get back to you, give the mic back to you.
I will leave you with Dr. Najah. Do you have anything to add with this?
I will quickly come into another perspective. I think Dr. Saad and Mother clearly explained the mistrust notion from individual point of view, but I'll try to put the into collective and international level. It's very right that the coronavirus taught us that you are alone by yourself at some point, and you need to count on the resources and talents that you have within your own territory. So that is one plain truth that you can't go beyond it. So, and it does actually contribute goes against the notion of multilateralism and cooperation among the peoples and even in specific blocks and region. This is also another perspective that you may need to consider. The COVID-19 has also taught us that the borders, physical borders that we had as a means of protection is no longer relevant. This little tiny virus can go through and travel in a very short period of time from one place to another. Imagine the instant that I made in my initial conversation. China, I mean, World Health Organization officially classified coronavirus as global pandemic around March 11th, and in 10 days you had the first case confirmed in Somaliland, and you see how the world is interconnected. And the point I'm trying to drive home is the world will now know more that we are on the same boat, regardless of the preference. So while the mistrust will remain, it's my view that the need for cooperation and collaboration will overtake, and a lot of instances are now happening. Think about the joint diagnosis facilities, vaccination led by one particular areas or continent or region for the benefit of the whole world. So it is a delicate mix kind of it, but it's my view that the latter will overtake the other one. I thank you so much, Hibak.
Thank you very much, Dr. Saad, Dr. Abdurrahman, Dr. Najah. I hope this gets you well. The answer was very clear for the question. We'll go. This question is from Abdurrahman to Lidet. Lidet, you hear me? Yes. The question is for you. He's asking you, what was the strategy used by regional organizations to bring rescues together to address COVID and other challenges?
Okay, so I'll maybe first start with what is being done at the continental level. So as Dr. Abdirahman mentioned earlier, there's the African CDC, whose work so far has been to sort of put together information, so collaboration, collection of information, but then also planning ahead to see if the continent could collectively also have as many people tested as possible. This is something that they did as soon as the pandemic broke out. In addition to that, as I mentioned earlier, the pandemic is recognized not only as a health crisis, but also as an economic one. And some of the initiatives at the continental level are, for example, to have like a response fund in which member states, but also international development partners, but also African private sector could chip in to support the continental fight against COVID. So this is again very much linked to the health, responding to the health crisis. And then in a similar way, the AU has also now launched a collective platform for procuring PPE or personal protective equipment and also medical equipment, because if you recall, particularly at the beginning of the pandemic, but still continues now, the market for PPE and medical equipment was quite overwhelmed because a lot of countries were hit by the pandemic at the same time. As a result, there was quite a lot of competition to procure medical equipment. There was a shortage. As you also recalled, so many countries that produce these things had also prohibited exports. So there was some shortage in the market, in which case African countries, even if they had the money, actually didn't have the means to procure it globally. And if you are procuring together collectively, you also save money, because you can, the price that you get when you are procuring at scale is very different from if you are procuring at a smaller quantity. So in order to take advantage of, you know, this, the collective or the price at scale, they have now launched this platform in which all African countries could procure together. This also, you know, saves you money in terms of logistics, because some of the challenge for especially the smaller African countries is not that they didn't have the money. Even if they did have the money, not being able to get it out in the market and not being able to coordinate the logistics of also procuring at scale was a structural problem that some suffered from. So in order to address this, there is already mechanisms in place. And then the other thing is to get to the economic aspect. There is now a special envoy that is set up by the African Union of 4 eminent personalities, so that they could discuss with the continent's lenders, because as you know, so many countries in Africa have debt to pay. For some countries, it could go up to 15%, 20% of their GDP is paid out to debt servicing. In order to put a halt on it, now the AU has put in a group that would negotiate on behalf of the continent with the World Bank and other international lenders. So these are some of the initiatives that have been put in place to sort of galvanize the collective bargaining power of the whole of the continent at the global level.
Thank you, Lidette. And this question is for you, Dr. Saad. And Hussein Mohammed asking you, what is the impact of COVID-19 on the informal sector, including hospitals in Somaliland, hospitality in Somaliland? I will say this again. What is the impact of COVID-19 on the informal sector, including hospitality in Somaliland?
Well, thank you very much. The coronavirus impacted the economy like all the economies in the world. And within our economy, it affects both the formal economy and the informal economy. In a survey we carried out a few weeks ago, it was very obvious from the responses of the traders that they have been affected through many ways. They said that they have been affected because of lower demand. They have been affected because of a lack of access to finance. They have been affected because of the interruption of the supply chain. So all these affected. And in fact, they said, the majority of them said that they were afraid they may have to close their business because of the virus, and that they knew someone who already did that. So it has been really devastating economically. And the reason that we relaxed the restrictions was based not only on the improvements, you know, detected in the health parameters, but also because of the weight this has put on the economy. So yes, it has affected the informal sector as well as the formal sector, and the government as well.
you. Thank you, Doctor. And this question is for Dr. Abdurrahman and from Abdurrahman, from Mohammed Yassin on Facebook. What regional countries so far has done cooperation COVID-19 pandemic? I'll say this again. What regional countries so far? Okay, go on.
Okay, so if I understood the question, Mr. Mohammed Yassin, is how many regional blocs did well against coronavirus? That's my understanding.
Yes.
And I assume it's in the context of Africa, right?
Yes.
In Africa, I think that it comes back to my original, where I started with, which is before COVID or pre-COVID, strength of health system. South Africa really did well, although they do have many patients, cases nowadays. They started really well and they had a strong and quick reaction to it. As I mentioned, Rwanda did well, Botswana did well. So who did well? It's proportional to their underlying health, underlying strength of their health infrastructure. So I think simply said, you had relatively good health system, you had enough kind of baseline to tackle initial fight against COVID-19. But the good thing about the COVID-19 now is that we all know that it has no treatment yet and no vaccination yet. So the best way to do is a prevention. I will take this opportunity to again emphasize the mitigative measures that has been put initially in place. Some of them has been alleviated, Dr. Saad put, that's common everywhere in the world. You have to balance shutting down the economy and fighting the COVID-19. So we need the economy to be open, but I think opening economy should also come with maintaining and not letting the gas off to continue with social distancing as much as possible and hand hygiene and everything else. Back to you, Dr.
Thank you, and Doctor. Second question will be for Dr. Saad and Lidet. The question is, the security is key, and as also mentioned by Dr. Sher, for any cooperation and also for regional integration cooperation. How this could be possible if in our case, East Africa, the director or directly or indirectly conflict region between all neighboring countries, extending East Africa bloc, see Somaliland, Somalia, and Ethiopia, Eritrea, Sudan, Kenya, Somalia, and Ethiopian, Sudan, and Egypt and this question is from Yasin Ahmed for Dr. Saad and Lidet.
Yes. Well, if I may start, it's true that we have issues between countries in the Horn of Africa, as you mentioned, but that hasn't prevented us from collaborating when it comes to dealing with a common threat, as the pandemic is really a common threat. We're working closely with Ethiopia, with Djibouti, with the assistance of some international organizations to ensure that the disease doesn't cross borders and is contained. So there is a collaboration despite, the differences in certain political issues.
Great, and Lidet?
Yeah, I mean, I think this question on security is one that is fundamental and structural, and it is also a question that I think should be asked on how to have regional cooperation in a region that has a lot of political tensions, even before COVID. So I don't necessarily see it tied to COVID, but it still is a worthy conversational question to have. I think, as Dr. Saad said, in general, countries sort of pursue their conflicts at the same time, also cooperation together, right? Like they tend to run it in parallel. So Ethiopia and Sudan, or Ethiopia, Sudan, and Egypt have so many issues that they don't see eye to eye on. But then also, if you look at, you know, the trade balance between these countries, the flow of people between these countries, despite the political issues that they have at hand, these things continue. So in a way, particularly at this point, we don't have a lot of conflicts where two states have completely cut communication and have completely cut diplomatic relations with each other. It's just that some issues like COVID or other tensions could sporadically tighten the tension between countries, and at other times the political tension is passive, and all other cooperations are still managed. So you will have health cooperation, border cooperation, mobility cooperation, economic cooperation, and then you're still working on your political situation. So in a way, I see it, it's not the tensions in the region are not totalistic. I think there's a lot more diversity of realities or nuance there.
Thanks once again. And unfortunately, we are receiving a bunch of questions from the audience, but I'm sorry to say this, but we have no time. Now I will go with our panel to say the last words about the issue that we have discussed. I will start with Dr. Saad.
Right. I think I will start, initially I started with the economics. I think this time I will start with the coronavirus health aspect. As the doctor said, our health is not in the hands of the doctor, it's not in the hands of medicine. At the end of the day, there is no medical treatment for this disease. It's not in the hands of the government, it's in the hands of the individual. I think it's the main responsibility to ensure that this pandemic is put under control lies with the individual. All that the individual has to do is what the doctor has been preaching. That's, you know, sanitation and social distancing and wearing the PPE equipment, you know, the face mask, and you know, I'm being careful. That's really all we have to do, you know, to eliminate or in fact diminish the transmission of this disease within the community. Of course, the government, as the entity responsible for the community as a whole, has responsibility to ensure that that the conditions are there for those, you know, who are infected are treated, you know, and those who came into contact with those, you know, who are treated or who fell ill are traced, and at the same time either treated or isolated in their own homes or elsewhere. But that's as far as the health is concerned aspect. But with regard to the regional integration on this issue and other matters, I think it's very, very important. Europe, you know, has, you know, a very important and a very effective regional organization, and there is no reason why, you know, Africa and East Africa in particular cannot have a regional organization which handles and deals with all these social and economic issues. I think it's just a matter of goodwill. I think it's time we stop squabbling and doing something for our people. Thank you very much, and over to you.
Thank you to Dr. Saad and Dr. Abdurrahman. Your last words about issue. Yes, go on.
Thank you. I will agree with everything Dr. Saad Ali said. That is absolutely the reality. So I would add that we need economy to fight COVID-19. It needs a lot of resources, as he mentioned, and we all know it impacts the economy. So we need to have some economy moving. Movement of economy carries with the risk of spreading the disease. So I urge all of you and everyone who has any influence to our community to preach that basic steps of mitigation needs to be maintained as long as possible. Where I'm living now, where COVID really devastated as a country, there are a lot of mitigations and retrofitting of how we do our life, restaurants, how to go to line, how to disinfect the seating. So a lot of things should remain. I will leave that with the coronavirus. And I will add one thing. As I mentioned earlier, no treatment and no vaccination. We were waiting for herd immunity, what we call in English, which is if a substantial amount of community get their disease somehow, the spread will stop. There are new studies, as most recently published by Lancet, a huge, well-reputed organization, that there's even question the herd immunity is possible without even vaccination. So I would like to again emphasize, keep your guards on and water down. In terms of regional integration, local integration, I would support, really emphasize local integration rather than a kind of depending and keeping our plan with a additional Western superpower that helping us make decisions. I would fully agree with local regional integration. Back to you, Hiba.
Thank you, Dr. Abdulrahman. Dr. Najah, your last words.
Thank you so much. I will make three quick closing remarks. First, the first remark that I want to make is coronavirus is not going anywhere unless we have a vaccination. There are contemplation in the medical professionals that there might be a second or third wave anywhere in the world. So that is going to be a kind of living condition that we need to anticipate. Two, with that context in mind, we ought to bring a creative solution to managing the other spheres of life other than public health and segment. Our region requires to think beyond the COVID-19 pandemic situation that we are in today and find a way, policy means and ways in which we can live the new normal that we are living tough and trying time. So those are the three concluding remarks that I may leave. And thank you so much. Over to you, Hiba.
Thank you. And Dr. Najah, Lidet, you're the last person.
Yeah. I think my concluding remark is basically just one, which is I think for all countries, there needs to be an assessment of what requires national action and cannot be left to cooperation, and what could be better achieved through cooperation. So in a way, as much as we understand that cooperation is the way to go, it shouldn't also hide the fact that some things just require a lot of national attention and should be a particular responsibility of the government. So in a way, I think countries need to balance that, be it in the Horn of Africa, but also within Africa as well, and then globally. So balancing this, looking in, but then also looking out, I think is one thing that so many countries need to take seriously.
Once again, and thank you, Lidet, Dr. Saad, thank you, Dr. Najah, thank you, Dr. Abdulrahman, thank you Hargeisa Cultural Center for making this amazing and important session. I will leave you with Tirset and Tirset.
Thank you very much, Hibak. And as you said, thank you very much, everyone. I was expecting, Dr. Jama, do you want to say a few words before I pass it?
No, just to probably a little bit anticipate one of the most important sessions that we will have in this conversation to next week. But first, I would like really to thank all our audience who asked so many questions and that we didn't have time to answer. We will try next time to manage the time and allow people's questions to arrive probably in a group, because I see that they have got a lot of questions to deliver. If you allow me just to say a few words of what's coming next Wednesday, which I think is really important. We will be talking about the democratization and state emergency. and because of we chose this session, and we are seeing in many places, elections postponement that are coming, executive power that's taking place, and this usually is something that many other African countries were fearing of. So we will talk with experts. Probably you will help me as organizer who we will have next time. But the theme is really important, and we expect and we hope we invite our audience who are following us to follow the next Wednesday session. We will be talking about democratization. If you help me, who you have as a guest, it will be really good.
Thank you very much, Dr. Jama. And I'll not take much time. As he said, next week we're going to have the democratization, election postponement, state of emergency, and executive power during COVID times. And our experts will include Rashid Abdi and Dr. Michael Oldemariam. And we are going to have also a phenomenon. And this will be, we have a lot of regional experts who are covering specifically Horn of Africa, plus the regional as a continent. And you definitely will see from the announcement. But I really want to say thank you very much once again to all of you who took time and participated as a panelist, plus everyone who was joining us through the social media, sending all those questions, also those who were in the Zoom platform. So thank you very much, and I'll hope to see you all in the next episode. Good night.
Well, thank you very much. Bye-bye then.
Thank you. Bye.
Thank you so much.
Thank you.
Bye-bye.
Thank you.